Yesterday, we reported on how the Centers for Disease Control and Prevention made the sudden recommendation to shorten its COVID quarantine and isolation time from 10 days to just 5. According to reports, the new 5-day guideline comes after the Delta Airline CEO asked the CDC to shorten quarantine, saying, quote, the 10-day isolation for those who are fully vaccinated may significantly impact our workforce and operations, unquote. 10 days is still the guidance in Canada, Europe, and the UK.
Since the surge, thousands of flights have been canceled. Delta said it expected to cancel more flights today after canceling more than 250 flights already, marking a 5th day of flight cancellations due to staffing shortages from infected flight crews and weather. Host of Working People podcast and editor-in-chief at The Real News, Max Alvarez, and associate editor at Reason, Liz Wolfe, join us to discuss this sequence of events. Welcome to you both.
Thanks, guys.
So, Liz, I saw some people on Twitter complaining yesterday that, well, the Delta CEO shouldn't be making pandemic policy. He's not a scientist, whatever, that kind of thing. But, I think probably...
Fair point, right?
That is a fair point, but probably the guy who's the head of airlines has some expertise about at least what airline policy should be when he was talking about, maybe we don't need to wear masks on planes. And, is the shortening of the quarantine period kind of just a reflection that, everyone is getting it right now. Everyone I know is getting it. Probably more people in the last month that I know personally have gotten COVID than in all the rest of the months of the pandemic put together. And we're just going to have massive shortages and actual inability for the number of people who would need to quarantine under the old guidelines to actually do it.
Absolutely. People keep roasting this on Twitter, saying that public health decisions shouldn't be made by business leaders or by CEOs, and that really this is a business decision, not a public health decision. What these people are missing is that all COVID-related public health decisions have weighed a mix of the scientific benefits of locking down or of various quarantine periods with the economic costs that we incur from having those policies. This has always been a push and pull, a give and take. And people are acting like these decisions are made in a vacuum. They're just not. I think it's really important for people to consider the absolutely extreme, exorbitant costs that will come if you have to do 10-day quarantine periods for fully vaccinated breakthrough cases. We're already dealing with so many flights being canceled around holiday time, lost business meetings, lost family events, people unable to travel for loved ones' birthdays and special occasions. We would just see that worsen as Omicron takes hold. I have Omicron right now. This is something that's literally going to just spread through all kinds of workforces. And the best thing we can do is try to test our way out of it. And I think that's what a lot of airlines are trying to do.
And Max, first I want to correct something I said yesterday, which Robbie was right, I was wrong. Yes, as usual. I had said that I thought that this applied to people who were in close contact with somebody. Actually, it's only for people who were infected, which is even wilder.
Right. Asymptomatic infections, I think is what they said, right?
It's infections. Clearly, if you're still testing positive, then that doesn't...
Well, if you're still sick.
Right. If you're still sick, then you can't be like, well, it's been 5 days. Liz,
but I'm still
Liz,
sick.
yours has been longer than 5 days. You couldn't just show up and be like, well, look, I did my 5 days, so I'm gonna hack all over everybody now. Max, what's your read on the Delta, which is in Atlanta, and so that has kind of outsized influence and resonance around the CDC? Delta CEO comes out and makes a suggestion, and they're like, you know what? Fine, let's do it.
I don't think my read is going to shock anybody, right? I agree, right, that, it is naive to pretend that all basically public health decisions that have been made over the course of the COVID-19 pandemic have not been made, out of that sort of process that Liz was describing of, different kind of parties weighing in with costs and benefits. Personally, I feel like looking backwards, there's a pretty clear track record where the needs of companies, the needs of the market have basically superseded the needs, anyone else's needs throughout most of this. I think that that's kind of been the ones who have won out of that tussle. I guess what I would say is when we're weighing those costs and benefits, whose costs are actually entering that discussion, right? Even now, we're talking about the costs that airlines like Delta would take if workers were actually required to quarantine for 10 days instead of abiding by these new CDC guidelines. We're not talking about the cost to workers. Like, much that's always been the case, right? Workers have been screaming throughout this pandemic that their lives matter, that their families and their safety matter, and time again they've been overruled. This time last year, the nurses union was, this time basically 9-10 months ago, the nurses union was begging Biden to not roll back the kind of mask mandate, because they were the ones seeing kind of the results in the hospitals that they were working in. And since then, like, they've been kind of reaching out to me and telling me, it's like, yeah, it's only kind of gotten worse. Right now, hospitals are at near capacity. So I'm not naive in the sense of, believing that, like, yeah, we can't just kind of say screw it to all the sort of economic costs. But, like, I think just the bare reality that is very easy to lose sight of is that we're not talking about the costs to the human beings who actually make the economy run. We're talking about the profits and, operability of companies that really see their employees as numbers, not as human beings.
On Tuesday, the U.S. set a single-day record of new COVID-19 infections with 441,278 new cases, according to the Centers for Disease Control and Infection and Prevention. The numbers eclipsed the previous high of roughly 290,000 cases reported on December 20th. That nearly passed the previous daily record, 294,000, set last January before vaccines were widely available. The 7-day moving average is now more than 240,000 cases a day. So, Liz, I feel like, looking at some of Biden's comments recently, even just kind of some comments from, I think, what I term Team Blue, sort of Democratic policymakers, mainstream media figures, progressive media figures, I'm seeing more of a, this is not totally across the board and not strong necessarily, but a giving up, or this thing is really contagious. Everybody's going to get it. What more can we do? Biden, said some comments that were slightly misconstrued in the press, but basically saying, what more do you want the federal government to do? Trump was sort of derided by all of these people for that approach, but now more people have died during the Biden year than under the Trump year, and he's sort of working himself to the same place. What do you make of that?
Well, there's a few differences in terms of the response. I'm in favor of holding Trump's feet to the fire because I think he really, really botched the initial pandemic response. I don't think I'll ever get over that. And I don't think anybody should get over that. We should have rolled out a testing and tracing and isolation scheme. And if we had done that early on, I think we could have saved many, many, potentially even hundreds of thousands of American lives. Okay, like that would have been a really good thing. I do think you're right, though, to tap into the fact that there is a sort of defeatist attitude that's currently existing, that I think when Republicans have displayed that, they've been, criticized all around. But now that Democrats are sort of having this defeatist attitude, we're giving them a little bit of a free pass. I do think one thing that is worth considering, though, is that the Omicron variant is just fundamentally different than that which has preceded it. I mean, we're seeing huge surges, record case numbers in New York, in D.C., in New Jersey, Delaware, Puerto Rico, all kinds of places all over the country. But one of the things that I think is worth considering is, we have to pay attention to the lag because of how this virus works. We're seeing, an 8% rise in hospitalizations nationwide compared to 2 weeks ago. So I think it's a really lucky thing that we've had such high vaccination numbers. We're not seeing people being admitted to the hospital by and large in huge numbers compared to case counts. We're not seeing people dying compared to case counts. Obviously, this is subject to change, but based off of what we know about this virus, this specific variant, we might sort of be in the home stretch. We know that they mutate to become typically more contagious, but less deadly. And that's exactly what we're seeing with this. So I think some amount of defeatism is perhaps warranted. And it'll be really interesting once this wave courses through the U.S., whether we do actually roll back some of these crazy pandemic restrictions that we've really grown accustomed to for the last almost 2 years.
And Max, I think there's also an interesting political economy lesson in this moment. If you think back to the government shutdown around the wall, the thing that finally ended that, if people remember, was Sarah Nelson and the flight attendants union saying, you know what, you're shutting down, we're not showing up for work. How do you like this? And then 24 hours later, the government's like, oh, okay, never mind, we're back. Like, there is a peculiar role that airlines play in our politics. And I think it's my read on this is because both parties are so kind of elite dominated, and airports are freedom to the elites. Like, they need those airports running smoothly, that it has an outsized disproportionate impact on our political economy. And so all of these flight cancellations, all of these elites, and not just elites, but all of these people being inconvenienced over the holidays has them changing their calculus about when airline workers ought to get back in. How much do you think that alone was driving it against the entire kind of structure of the economy, where obviously all bosses want all workers back as soon as possible?
I think it's a great question. I think it again, we, not to overuse the word, but I think we would be willfully naive to pretend that that was not playing a huge factor, right? I mean, because you could even see the inverse of that over the first year of the pandemic, when people who were largely safe, in their, I don't know, second homes and being able to zoom in for interviews on mainstream media, they were kind of saying, go sacrifice yourself for the economy. Whereas, workers on the ground were saying, like, hey, can we please get more PPE, right? I mean, like, there's always been that kind of divide. And the more that, the comfortable have been aggrieved by the results of a pandemic that has been so disastrously managed, the more that their tune has kind of changed. But I think the constant is, again, the kind of lives and sacrifices of everyday working people are really like at the bottom of the list of priorities when making these sorts of decisions. I think that, to kind of quickly mention one other postscript to the question about Delta, right? Remember, you've seen kind of the signs from this company. We know that how virulently Delta has fought off unionization efforts in Atlanta, because it does not want to have workers having the type of say that could be benefiting them right now, where they could actually be bargaining over this kind of thing. They could be making demands. Instead, it's really, like whatever, the CDC and the CEO are able to say that workers have to kind of follow. But Delta is the same company that was like putting up signs telling workers to buy video games instead of pay union dues. We all saw those kind of screenshots floating around social media a couple years ago. This is not a company that really cares all that much about its workers. It may say so, and let alone its passengers for that matter, right? I mean, like, remember, it wasn't Delta, it was United Airlines with that viral video of a man getting like dragged out of his seat. But like, think about like all the ways that airlines have sucked for us, right? The seats have gotten closer. Everything's gotten more expensive. Like, it is the fundamental crystallized example of how something that is directed towards profit kind of like ruins everything else.
Well,
and yet
I
we're
take
letting,
that point,
like,
but a lot of
this
what I
thing,
hate about airlines
us.
was forced on them by the government, right? Some of the most horrific, the routine strip searching and all of that kind of stuff. The militant mask enforcement is a government requirement. But yeah, I take your point.
Don't get Robbie started on the airport security.
Well, and
hate.
Yeah, so I mean, like, there are a lot of people to be pissed off to your point, Robbie. But I guess the last thing that I would say about this defeatism thing, because I think it is real. I mean, that's what I see. I see that Democrats, and I guess what you called the blue corner, Robbie, it's like, it kind of is just throwing up their hands and saying, like, this is the best that we can do. The deaths are going to be minimal. We got to like kind of prioritize the economy and move forward. Yeah, that is very much like, like a very similar version to what we were having under Trump. I think the one difference that I've seen is, again, when I was watching kind of Trump-aligned people, business leaders and think tank people and whatnot, saying similar things a year ago, it was very much in the vein of like, look, like, we can't control this anyway, so we have to kind of throw our bodies on, like the pyre for the sake of the economy. There wasn't so much defeatism as there was a sort of like acceptance that nothing could be done. But I think the bare fact that we've all sort of danced around is that we screwed this up so irrevocably that there basically is no way that we can kind of correct it. We could have tried to eradicate this on a global level, but again, we didn't. We screwed up, and now we're kind of trying to fumble for the best option in a terrible situation.
And two situations are drastically different, but I do think it is worth considering with this variant, which we know is incredibly contagious, but a lot less deadly, with the arsenal of tools in our, Paxlovid and various antivirals plus vaccines. It's worth sort of asking the question, is the defeatism somewhat warranted, or is this a reasonable cost-benefit analysis given this variant at this late stage in the pandemic?
Right. Got to leave it there. Great discussion. Thank you both, Liz Wolfe and Max Alvarez, for joining us. We really appreciate it.
Thanks.
Thanks, guys.
And we'll be back with more Rising right after this.